Hello and welcome to episode 58 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is back bracing. Are braces for your back helpful? Can they help with pain relief? Do they have a place? Well, there's a new article in 2021 that will give us an answer that we are dissecting today. Now, if you did not catch episode 57, the last episode, it's all about lumbar rotation. So many people are under the opinion that lumbar rotation is bad for discs, can cause disc herniations, is bad for disc herniations. Our lower back was not meant to rotate and all this stuff. It's a bunch of garbage. And if you want to know why, go listen to episode 57. Also, if you have not joined my private Facebook group, do so. This is open to anyone who follows me or who listens to these podcasts where I post additional content, exclusive content that I do not post anywhere else. Detailed instructions on how to test your sciatica, how to resolve your sciatica, how to understand the right movements for your sciatica. It is called RehabFix Low Back Program, and it will be linked in the show notes. You will not get content like this anywhere else. So it is exclusive to those who request to join the private group. Now, let's get into it. Back braces. So many people wear back braces at work or just, at the gym or just sitting at their desk all day or just walking around doing life because they have a low back injury or they're afraid of re-injuring their low back and they're under the perception that a back brace is something that they should do. Or maybe they've been told that they should do it by a doctor who is not trained in low back disorders or is just not very good at low back disorders. Already kind of shows my opinion there. But let's not put my opinion into this. Let's put the evidence, right? A lot of people sometimes will comment about, well, you say this and you say that. A lot of the times, guys, these aren't my opinions. This is the evidence. And sometimes I just report what the evidence says. So we're not going to have anyone's opinions. Let's look at what the evidence says. Okay, so here we go. Article in 2021. I will link this in the show notes as well. It is called Lumbar Bracing for Chronic Low Back Pain, a randomized controlled trial. Now, here's how it was set up. First off, chronic low back pain is defined clinically as back pain that has persisted for greater than 12 weeks. All right, so within this study, they had 61 adults with uncomplicated chronic low back pain with image findings of degenerative spondylosis. Degenerative spondylosis is basically just degeneration of the spine, right? All that means. And this is to assess the effectiveness of a semi-rigid back brace. All of the participants received back school instruction. So this is just instruction that consists of education and exercise. Education and exercise. While the treatment group also received a lumbar orthosis. So this is a back brace, all right, which they were instructed to use as they felt necessary or as they felt needed for pain relief, that kind of thing, okay? So essentially they had two groups here. Two groups. One was assigned a back brace. The other was not, to test the effectiveness of back braces. Now, both groups were provided education and exercise. But the variable here is that one of them was given a back brace because so many people are under the belief that a back brace is helpful or is needed, just like so many people think boots for their ankles or casts for their shoulders or knees and all that stuff is effective, which the evidence shows it is not. Booting things is not effective. The same applies to the spine. So get this. When they compared the outcomes of this study between the two groups with chronic low back pain, both received education and exercise, but only one of them received the back brace. The ultimate outcome between the two showed that the group with the back brace had no additional clinical significant outcomes than the group that did not. What does this mean? This means that education and exercise is king, and it will always be king. And if your plan does not include education and exercise, then you're on the wrong plan. That's what that means. So, as I mentioned, many people go towards restricting movement of things. Oh, I hurt my ankle, gonna boot it. I hurt my foot, gonna boot it. I hurt my knee, gonna boot it. Hurt my shoulder, gonna cast it or sling it, right? This is old school thought. It is old school thought. It is not good for injury. It is not good for recovery. It is not good for these things because, one, it perpetuates the notion that it needs to be protected. And your spine is one of the strongest things in your body. It is so strong. There is so much connective tissue around it. There is so much muscle around it. Your spine is so strong. It is so strong. So if you're always wearing this back brace, it's going to make you feel like it's fragile. You got to protect it. Oh, I can't do this. I can't do that unless I have my back brace on. It's training your brain to think it's fragile. And I've made a post like this many, many times. If you treat your body as if it's fragile, you will become fragile. That is a fact, okay? Thoughts become things. If you're always thinking your back's fragile, you need to wear a brace, otherwise you're going to break yourself doing something, you're training your body to feel weak. You're training your spine to feel frail. That is how it works. You got to build confidence. You got to build freedom of movement, because if you're not resolving your back issues with movement, with exercise, you're on the wrong plan. Out of the hundreds of clients that have gone through my program, and I post my results all over my social media, not a single person has worn a back brace, because we are fixing disc herniation and sciatic issues all around the world with education and with exercise. What you are training someone to do with a back brace is you're training them to not move it, to protect it. That's what you're training them to do. And that is a mentality that's going to put someone in a trap. That's going to create more low back pain at times, because it can put them in a chronic state. If, of course, you're not providing additional movement and education with that. If you're just telling someone, hey, here's this brace, you're probably better off giving someone no advice than telling them to wear a brace, to be honest, okay? A brace is probably just a negative in most situations. So, no opinions involved. We see the evidence. I'll link this in the show notes so we can all take our opinions out of it, regardless of, and hey, there's some psychosocial components here too, right? Some people are going to comment, hey, Grant, but when I wear a brace, I feel better. That's great, right? Sometimes when I wear my favorite shoes, I feel better. Okay? Sometimes when I wear a weightlifting belt, whether or not I have it tight or not, I just feel better because I just feel like, oh, it makes me stronger. Yeah, I feel great. Okay, there's tons of psychosocial components to this. So I'm not saying that it's impossible for someone to put a back brace on and then feel better. If it makes you feel more secure mentally, if it makes you feel more confident mentally, well, then it's going to make you feel those things, right? That's the way that you feel. No one can change the way that you feel. I'm just reporting what the evidence says and what the potential scenarios are within this realm of putting braces on people and maybe or maybe not having education and exercise. So these are just a few angles to dissect within the advice that you've been provided so far. If you are not being educated with exercise, your plan's going to miss a lot of things. Okay, so there are no quick passive treatments, adjustments, e-stim, scraping, massage, acupuncture, laser, PRP, prolotherapy, injections. These will not be long-term solutions because they do not provide education and they do not provide exercise. That is why. So if you feel like you're spinning round and round, reach out to me, reach out to my team. Let us help you. Submit an application, get in touch with us so that we can talk about things and make sure that this is the right fit for you so you can get off this medical hamster wheel spinning round and round. One day you feel good, next day you feel bad. One day you feel good, next day you feel bad. You're continuing to put it off because you're thinking, oh no, I think this is finally that time where my back pain's gone. Oh no, it's back. And then a week later, it's back. And a week later, it's back. Get off that wheel. Get off of it. Have a structured plan. Have your sights set on that goal at the end. Know what you're going to achieve. Have the guidance, okay? Let's not pretend to be low back experts if we're not. And if you've been continuing to struggle for these issues for weeks, months, years, it's time to stop guessing. And whatever plan you're currently on, it's obviously not working. I hate to be blunt, but that's just the truth. So let me help you. Let me help you. Additionally, join my free Facebook group, RehabFix Low Back Program. is the name. If you are watching this on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.